Good afternoon, everybody, and thanks so much for joining us for the second installment of our series, Prison Research Meets Practice, where we're going to be talking with a couple of experts about correctional officer wellness. My name is David Pitts. I am the Interim Associate Vice President for Justice Policy at the Urban Institute, where I also direct the Prison Research and Innovation Initiative, which is an Arnold Ventures funded project that is the sponsor for the series. Before we get into the content that we have for today, I would like to talk with you a bit about some housekeeping items. First, please keep in mind that this event is being recorded and the recording will be posted online afterward. The speaker biographies, for those I'm going to introduce in a few moments, are available for you online at urban.org. For accessibility purposes, we are providing ASL translation and we have closed captioning enabled. Keep in mind that you can adjust your caption settings with the Show Hide Captions button within Zoom. All of the participants are muted, but please feel free to type any questions or comments that you might have for the panelists into the Q&A box at any time, and we will save time at the end for those. We ask that you please take 1 to 2 minutes to complete the survey at the end of the event. And lastly, we ask that you engage with us online using hashtag #liveaturban. All right. So now I will ask my my speakers, panelists, to join me on camera, and we will get our discussion started. I am really fortunate to have with me today Professor Lisa Jaegers, who is an associate professor and co-director of the National Corrections Collaborative at St. Louis University, along with Andy Potter, who is founder and executive director at One Voice United and also an advisory board member with the Prison Research and Innovation Initiative here at Urban. Thanks to Lisa and Andy for joining me today. And I will go ahead and get us started with about 40 minutes or so of conversation, after which we will move to questions and comments from the audience. So again, please enter those in the Q&A box as we talk in the first part of the session. So let's get started. And I would like to start with Andy and orient our conversation by getting a sense of what officers and other correctional staff are exposed to that make their jobs different from others. So Andy, I'm hoping you might be able to talk a bit about the stressors that are faced by staff on the ground in prisons and jails and how those issues tend to affect their physical and mental health.
Thanks, David. I appreciate it. And I appreciate being here. And I would just start out by saying a few key factors, a few differences are that right away, when we come into this employment, we come into a paramilitary structure. And when you start training almost day one, you're really trained to have a lot of distrust, especially in particular for those who are incarcerated. And starting day one, you're desensitized and you have this nonstop hyper awareness that stays with you for 24/7. So you can imagine every day you have a certain amount of adrenaline that runs through you for the what if situations that could take place. And that's unlike any other employment that I've ever had. I mean, if you think about it in terms of coming in short-staffed, if you come in short-staffed in most other employment, you might drop a line, or you might have poor productivity that day. If you come in short-staffed in the correction setting, tensions elevate, can be very dangerous. It's a much different kind of environment. I mean, not many other employment that I've ever had trained me on how to prepare for possibly being taken a hostage at some point. I mean, there's some stark differences. Our PTSD rate, our divorce, substance abuse rates surpass any other public safety occupation that I can think of, and many other occupations for that matter. Our mortality rate has us dead at the age of 61. That's 14 years less than an average American. So yeah, I could go on and on probably about the differences, but those are just some of the top line ones that I can think of offhand.
Thank you. Thanks, Andy. So, Lisa, similarly, research is showing us overwhelmingly that prisons are pretty damaging places. And as Andy alluded to, not just for those who are incarcerated there, but for staff as well. And I know you've done a good bit of work on correctional officer wellness. I'm hoping you might be able to walk us through some of the main findings from that body of work.
Sure. Thanks, David. I appreciate that. And thanks, Andy, for your comments. I agree that correctional workplaces are absolutely different places of employment. They are unique. My background is coming from 10 years of doing injury prevention with workers in all types of manufacturing plants, pork production plants, you name it. I've seen all different types of industries. But when I walked into a correctional facility for the first time in 2014, I was a little stunned at the stark differences. So I talked to training officers and I tried to understand what's going on here. And this is what really was the trajectory and led to me becoming immersed in prison and jail research. And so what I've learned is that, yes, there are absolutely, from the start of employment to the first year, we saw officers developing higher rates of depression, PTSD symptoms, and so on. So there's definitely a relationship between that. And Andy touched on some of the types of things going on in the environment. And I do want to touch on some things, some findings towards what can we do about it? What ways can we change the way we think about the work and contribute towards intervention solutions to improve workplaces? And so some of our findings start with very simply listening, hearing, and learning from workers. And that lends to many participatory approaches. You may have heard of community-based participatory action research, you name it. I use the Total Worker Health Strategy by NIOSH. That's been tested in many different workplaces. And basically, I'm getting task forces together and trying to understand and listen, doing surveys, doing focus groups, and coming back to the table to problem solve. How can we address these challenges? And another area that we look at is in a partnership that we have with the National Institute of Corrections, is looking at the literature. So what are we finding? We found in a one-year study that over the past 26 years, there's only been 25 studies done to explore evidence around resources that are effective to address stress and trauma in correctional workplaces. So the amount of literature is so sparse that we are just on the cusp of making progress towards taking actions and really helping facilities to address these really challenging problems. And then the last piece of information that I'll share just from our research, in a study of critical incidents among all staff at a prison facility, we found that people are experiencing trauma directly and indirectly. It's no joke. Absolutely. If you walk into a correctional space, if you're an administrator, if you're someone entering data, if you're a food service person, maintenance person, you're going to likely be touched by some sort of trauma. But the challenge is we don't have ways to measure the level of trauma exposure, of violence exposure, and then understanding the metric for, did we do better? Did these interventions make a change? And are we making progress towards reducing these exposures to trauma that we know contribute to PTSD, depression, suicide ideation, and extremely sadly, actions towards suicide? So those are just some key things that I thought I'd touch on today.
Yeah, thank you. That's very helpful. And Andy, so Lisa just mentioned, excuse me, depression, trauma, suicidal ideation, steps towards suicide. And so I want to turn to you and talk for a moment about help seeking. So a number of DOCs and jails do provide mental health services to staff, but we know that stigma often prevents staff from taking advantage of those options. And I'm wondering, in your work, if you've seen some strategies that have reduced that stigma or worked well to encourage COs to seek out help.
Yeah, that's right. And thanks, Lisa, for your comments. All that is super helpful and really important. And hopefully we'll get to a lot of those pieces today. The stigma is very real. A lot of corrections frontline staff, whether it be a corrections officer, healthcare, it doesn't really matter. To be honest with you, there's a stigma attached to reaching out and saying, I'm struggling. There is this there is this macho kind of attitude that takes place inside of the culture in corrections. And we're always suspicious of any kind of like help kind of system where we have to go and admit that we're struggling. We're worried about what our coworkers might think. I've heard many times, many instances where folks are saying, yeah, I'm struggling, but I don't want to seem weak. I don't want my coworkers to not trust me. I'm going to be there for them, but I'm struggling right now. And I don't know how my supervisor is going to react. And I cannot tell you how many times I've heard somebody comment and say, you knew what you were getting into when you took the job, so just suck it up. Like it's part of the deal, right? And you have to put up with it. And that's not the case. We have to lower that stigma. And above all else, administrators have to support whatever wellness program that's put together has to be supported. And they have to encourage those staff members to take advantage of that opportunity and show them that it's a safe, comfortable place and that they won't be scrutinized for it. I think a good example really in the Michigan Department of Corrections, they've got a great program that was secured through budgeting and willingness of the Department of Corrections and the director. So Lynn Gorski leads a great program there. That's a place I think it's working in. I know that there's other directors and commissioners out there that are really trying hard. I've met a lot of them. And the best practices, really, the strategy is to support the work that's going on that Lisa mentioned earlier, to support that kind of, and to support the organizations that are putting together the data that comes out of those surveys and everything else. At One Voice United, I can tell you that for us, the mental health is a priority for us. In fact, at the end of this month, at our Elevating Our Profession conference, we're going to be bringing in experts from New Zealand and Australia, whose programs have really been successful to lower the stigma and to bring staff to a place where they can seek help. So we're interested in seeing how that all goes. And we should want to learn from best practices as well, internationally, nationally. Shouldn't prevent us from continuously seeking out the best practices and how we lower that stigma.
Thanks, Andy. Yeah. We know, I think also that a big concern among correctional staff is how their job affects home life. And so even if they are able to, as you put it, suck it up and deal with all of the stressors, that doesn't necessarily help them when they get home after their shift. And we know in addition to that, that a lot of families are corrections families in many states. There are two spouses that both work in corrections in the same household. You have parents and their adult sons and daughters working in corrections, siblings working in corrections. So there's often more than one family member in the profession as well. So I'd like to ask both of you this, but maybe start with Lisa. What are some of the ways in which families are currently involved or could be involved in supporting loved ones who serve in the field?
Yeah, absolutely. So I also want to touch on what Andy was just speaking of. There are amazing national efforts like the Green Bandana Project on college campuses. The construction industry is facing a lot of challenges with suicide. They have national efforts, and then even our 988 Suicide and Crisis Lifeline is being revamped. So those are supports, and people just need more information, and we need to get the word out about that. We know that social support is key to helping people and reaching out for help. And so literature shows that if someone feels comfortable with another individual, especially frontline workers are going to family and friends first, but that's challenging if the family and friends don't understand what's going on in the workplace. Similarly, we can use peer support, and part of our national study was to really dive in. Lots of places are using peer support, but we don't really know what that is, what it looks like on a way to, find evidence to support it or study it. But we know that people with lived experience, those COs with frontline experience who can talk to other COs, that's extremely important, but also people who can feel trustworthy and they feel that they are cared about and they know that they aren't being gossiped about, on the side after revealing their personal concerns. So with work-family conflict, the study that I did on the first year of employment, we found that work-family conflict, bringing in what's going on at home to work and bringing on what's going on at work home, that can have a really strong impact on burnout. So over the first year of employment, we saw that burnout was associated with increased work-family conflict, higher depression, and then shorter tenure, staying at jobs for a shorter amount of time, so that turnover. So we do need ways like orientations, introducing family and friends to the facilities, bringing them in, having periodic annual events, semi-annual events, potluck dinners, cornhole games, softball games, whatever it may be, to bring the community together and help families and friends understand, so that it's not this unknown thing that that your loved one is going to every day.
Great. Andy.
Yeah, everything you said, Lisa, is on mark totally. I think ideally, and I think some of those things are starting to take place in different places, but I think ideally, if the departments, when they hire new employees, would bring their family in for a day or two of orientation, really work with them and build a cohort, it also provides an avenue for folks who come in that are single. You have a lot of single parents and otherwise that come into this that also need a support group, and they may not have that at home. So that provides that kind of cohort for them when things are challenging. And if you can provide some form of helpline or a staff person that can reach out and talk to you when you start to identify things going on with your loved one that works in the department, like they're struggling, they're having mood changes and things like that. I think it's super important that be very transparent when you bring new employees in and show them the challenges of the job. The job can be a blessing in some ways to a lot of people, but it also has its challenges, and we shouldn't run from that. We shouldn't be afraid of that. We should bring the family dynamic into that as well. And I think it should be ongoing. I don't think it should be something that just stops once they get through the academy and into employment. That's something that should continue, I think.
Great. Thank you both. Thank you both. And this next question, you've each touched on in a bit throughout your answers, but I want to ask it directly. And that is that, I know both of you have been involved in efforts to address both system level and individual level barriers to wellness, so the things that prevent wellness from taking place. And so maybe we can go to Andy and then to Lisa after. What programs and methods have you seen that work well or have promised to be successful at breaking those barriers down?
I'm going to go back to what Lisa said earlier. When it comes to the research and things, it's only been the last decade that there's been this much research being done and this much data being pulled out so that we really understand what's going on. And we should also keep in mind, David, that this is a reoccurring trauma that happens daily. That's probably the first and foremost challenge that we have, is folks can't really get healthy until they retire. Or they find themselves coming out of the system completely. I would say that all of the research that's being done, though, we've been able to partner with some amazing groups. Lisa mentioned some of the work that they're doing, which is amazing. And you have organizations like Dr. Katerina Spinaris of Desert Waters Research and Dr. Nanika Jones-Tapia from Chicago Beyond. And I think even the NIJ has a lot of really good work going on. These are some places where I believe folks have come together to really open the eyes. You remember last year, David, we did the very first ever, you were a part of this commission. We did a blue ribbon commission on just bringing out awareness around wellness. And you heard from frontline staff, you heard direct testimony from family members and others that struggle with this. So I think there is a lot of work being done in this area. And again, I want to give some respect to some of the directors around the United States that have decided, like, look, this is challenging. The director of the Michigan Department of Corrections allowed for a statewide survey of correctional employees to be done that led to a very good wellness program. Now, had she not been willing to take that risk, and really understand what was going to come out of that survey. That's hard. And that is something that I just want to put a light on, because I think it takes a lot of I give them a lot of respect for doing it. So I think when it comes to wellness and the struggles that we have is the things we just talked about, the stigma, the fact that it's daily, reoccurring trauma is probably the two most things I think we're going to struggle with the most, David.
Lisa.
Yeah, Andy, I agree with what you're saying as well. And I had the opportunity to speak with leaders at the Correctional Leaders Association earlier this year. And the topics that we are touching on today are at the top of their priority list, as far as I understand, in terms of things that we were discussing. And they are seeking things that they can do. They're actively seeking. So that was really great to hear. Now, what we found in our National Institute of Corrections study is that through a national survey of prisons and jails, there could be a slight disconnect. And I'm guessing we would see this in other workplaces as well. But when we ask correctional officers, what do you find useful? What trauma and stress resources do you find useful to your work? Or I'm sorry, which ones are you aware of? They're aware of programming. For the most part, they're aware of things. But then when we asked them, what do you find to be useful or helpful among these things? There was very low interest or buy-in, or they didn't really feel that it fit their needs. Now, when we ask middle managers and senior administrators similar questions about the same resources, we ask them, are these being used at your facility? And then do you feel that they fit the needs of your workers? And overwhelmingly, the middle managers and senior administrators felt that they did fit the needs of workers. So the disconnect here is really understanding what things are tailored to the workplace. Are we getting that input from our workers? And do those resources truly fit? Are they accessible? Can people take off their shift to go to that mental health awareness training? Can they do those things that they really want to do? Or is it something that is available, but not necessarily usable? So those are the findings. And then we're also asking for those correctional workers, staff, to really offer constructive feedback. I went to the training, or no, I couldn't even get to the training. And then, what's useful about it being accessible, and how can we access it, and so on. So just that iterative process, that feedback process would be really helpful.
Thanks, Lisa.
Can I jump in on
please.
one thing? Just one thing. I just want to also add that when Lisa's talking about feedback, I think it's really important that they bring all the stakeholders together when they start to develop a program like this. Even the unions. I think the unions can be an accelerator to these programs, and I don't think they're utilized enough, and I don't think that their feedback is taken into account like it should be.
Thanks, Andy. Yeah. So there's often in our prison reform space a lot of conversation about the sustainability of change, and I think that comes largely from commissioners and directors that serve for relatively short periods of time, and a lot of movement around leadership positions that creates a little bit of instability. So I'll ask both of you, maybe starting with Lisa and then to Andy. What can we do to make sure that systems implement change that lasts beyond the administration of, let's say, a single thoughtful commissioner or a single thoughtful director?
Yeah, so sustainability and any sort of programming, community programming, change, sustainability is the big focus area that we need to consider. And so as I think more and more about this, what have I learned over the past 10 plus years? I think it's about the mission of the organization. And I'm considering this, that manufacturing scope, that other type of business scope where I've been in all these workplaces. And what I think about is those successful businesses or workplaces, they have a really strong mission and they're working towards something. And as an occupational therapist, I think about what's meaningful to workers. What are the things that they need, have to do? How are they maintaining safety, quality, and ensuring, the larger community is safe? And we need metrics for this. We need a way to measure what was a good day at work in a correctional facility. And oftentimes, I don't know. I don't necessarily know. So that's kind of my next phase is trying to understand the sustainability piece could be being able to report to our community leaders, our city county, state, or, government, hey, we had a good day because this many officers were trained and were able to reduce uses of force by this percent. This many individuals incarcerated were had their employment readiness ready to go, their social security cards, their state IDs ready. And when they stepped out of these doors, they had employment. So how are we shifting the mission, the purpose of what we're doing and how we're measuring a good day in a facility? And I think we're on the right track. We're moving away from punitive measures and really trying to problem solve how to not work so hard, but work smarter in what we're doing towards these goals.
Thank you. Andy.
Yeah, I would, in addition to everything that Lisa pointed out when it comes to the research and the data, and how we reinforce what does work and what doesn't work. I think there's something that's very important about this question, David, when it comes to how do we have sustainability? We all know that the infamous pendulum swing. You can have the most thoughtful corrections administrator, the best reforms together that there is. And as soon as that person leaves, they promote or somebody else is appointed or there's a new governor, right? It's the political winds shift from getting tough on crime to reform and then back again. We lose any good reforms that started to take place. We lose it when those administrators leave because it's in a policy somewhere. And I have a concept that there needs to be what I call a legacy in that change. So a legacy change is where all the stakeholders buy into whatever that change might be because they were able to help shape it. They were able to take stock in it and really have a stake in what that looks like. And in that, there shouldn't be a zero-sum gain. It should be something that everyone believes is safe and everybody believes is healthy. And then when the administrator happens to leave, those folks that are in charge of whatever that might be, the wellness program or whatever it might be, they're going to pass that on from generation to generation, the same way I was taught things from generation to generation. So I call that legacy change. And with legacy change, you're going to see a lot of sustainability in whatever those reforms or those policy changes might be.
Thank you. Thanks, Andy. And I'm actually gonna stay with you for a moment, Andy, and ask about avenues for change. So we've been talking for most of this session so far about how we can work inside departments of corrections, inside prisons and jails to change the ways that the organizations approach correctional officer wellness and how correctional officers might make better use of programming that could help them with that. But there are other ways that we can go about changing the corrections policy space. There are things like legislation and litigation and policymaking at the state level, some rulemaking. So I'm curious if, Andy, in your work with One Voice United or elsewhere, if you've seen any of those that seem to hold promise in this area.
I think there's a lot of changes right now that have bipartisan support that benefit a lot of people in a lot of great ways. I think legislation is critical when it comes to many different changes inside of a system like the criminal justice system. I know it was critical when it came to in Michigan when we put together the wellness, but we had a bipartisan support. We had a budget actually voted on, right, that supported that work. And I've seen a lot of good things come from legislation and I guess in litigation as well. You know, when things are in a situation and litigation's necessary, I've seen some good things come from confinement and other things, but I've also seen some bad things come from that. So I think it's a double-edged sword sometimes when it comes to litigation, because when you force change onto folks, they don't always accept that with open arms, and that can create a problem as well. Same with legislation. Sometimes legislation has a little bit of a butterfly effect we don't always see. But I've seen a lot of good come from both.
Thank you. Yeah. So in thinking about change, I think it's been my perception that a lot of the conversation in the prison reform space is really about incarcerated people and not really so much about staff. And I think we've also seen in our work with the Prison Research and Innovation Initiative and working with departments of corrections that a lot of times the staff and incarcerated folks both feel that they're at odds with one another in a zero-sum game, to borrow Andy's phrase from a moment ago, where if one of those sides gets something, the other side must be losing something as a result. And so I'm curious, I'm going to ask both of you this, maybe starting with Lisa and then to Andy. How does staff wellness fit into maybe a broader environment of conditions reform? So thinking about all of the different things that are taking place within the corrections policy reform space, how should we prioritize staff in that? Is staff appropriately prioritized? Should we increase that priority in our work? Lisa.
Yeah, this is a really great question. And like I mentioned, with my first step into a prison facility, and also hearing the voices of people incarcerated in Inside Out Alliance, I just immediately thought, okay, how are we bringing all this together? It just didn't make sense to me to have this siloed approach. And I think about that in, again, manufacturing plants and other places. You have human resources here, you have environmental safety and health here, you have the medical team here, and it just doesn't make sense unless you integrate things together. So again, that's that total worker health process. And what I see in a lot of the locations where prison facilities are, in some jails, that these jobs are the only things available in the economy for people to go to. Like, there's nothing else. And so we need to find things. And the individuals working at these jobs oftentimes are also having challenges with housing, with transportation. They're couch surfing, they're living in their vehicle, and they're working 2 or 3 jobs. So it's not that far from the experiences of many people incarcerated who also may experience homelessness and these different things. Now, in a recent scoping review that we just completed, a doctoral student of mine took on the task of looking at outcomes, where we looked at both literature, manuscripts or research that focused on both health outcomes of people incarcerated and health outcomes of people working in those facilities. So those were the criteria. This research study had to have both. And so in a span of probably 25 years or so, she found 16 studies that are looking at both. Okay, so this is even worse than the literature that I spoke of earlier. So it's even more sparse. People aren't looking at this, and we need to. And what the findings are, that where they looked at both, for instance, there are fewer punitive responses. When there were fewer punitive responses, people incarcerated felt the worker the worker relationship was better. They had more motivation to succeed, and it improved trust and feeling of safety. Okay, another study, by reducing solitary confinement, it led to workers having higher job satisfaction, better interpersonal relations, and improved overall safety for staff and people incarcerated. So we can't work in these silos and only be looking at one thing at a time. We have to be considering, if I move or shift this, how is it going to affect the system? And so I'm not like on one side or the other. I'm like, we got to improve it all. So how can we get the most bang for our buck and really try to have a broader impact?
Thank you. Thanks, Lisa. Andy.
Yeah, that's so true. A lot of people don't look at it this way, but we're inextricably linked. The conditions that someone lives in is the same conditions someone works in, and sometimes 16 hours a day and sometimes 24 hours a day. So we're in this together in a lot of ways. And I would just say, this is a hard one for me because I have my own views about the system and the way the system was deliberately designed. And the way the system was deliberately designed, in my opinion, is to pit one against the other. Wouldn't it be something if we all connected on something that harmed us all, as Lisa pointed out, right? And wouldn't that be something if we could all do that? But the way the system is designed, it really does prevent us from aligning on those kinds of issues. And I just think that if we could typically do that. And when there is change, David, most of the time it perpetuates the us versus them, because the stakeholders haven't been brought together in a way that's holistic. Similarly to what Lisa's saying, the studies are pretty clear that what affects one is going to affect the other. So I would just say that knowing that, I'll end by saying this. If we want the kinds of reforms that we're all talking about, that we're all looking for, you will not be able to charge those that are working in there with those reforms. You are not going to be able to expect them to carry those out in a safe and healthy way if they are not feeling safe and healthy themselves. It will not happen. And I always say, if you're going to talk about any reforms at all, the very first thing you should start talking about is this collectiveness around how somebody feels safe and healthy. And what do we do to ensure that first? Because then the rest seems to be a little easier, if that makes sense.
It does. Thank you. Thank you both for that. And I have one more question that I want to ask both of you before we turn to the audience Q&A. And that is, with all of this in mind, everything we've talked about so far, how would you characterize the prognosis for change in correctional officer wellness? So what are the areas of promise, and how can the public support the efforts? Maybe we'll start with Lisa and wrap up with Andy.
Well, I'm an optimist, so I think the prognosis looks good. I see, the past 10 years, sure, it's taken a long time to get here, but we're moving. We're seeing more grant funding opportunities from National Institute of Justice. We're seeing at the national level, the National Occupational Research Agenda that informs NIOSH has a public safety sector that includes correctional officer health and well-being. There are shifts and changes. And I think that if we look to our partners in other industries who are facing some similar challenges, not in the same context, we can learn from each other. And so I think that's really helpful to think about. We don't have to function in a vacuum where we think that correctional, we only have these problems. It's, many people are going through many challenging things. So look to other industries, be creative, and just try to be as innovative as possible. And then I love seeing communities of people in these facilities, from unions, from leadership, from education, research, and so on. Our National Corrections Collaborative, our Project Task Force, is a great example. We come together and we just want to learn from each other and network and share. Oh my gosh, I'm trying this, and I'm seeing some in the comments here. We're trying this and it's starting to work. So we've got to share, we've got to get the word out. So I think the prognosis is looking positive.
Thank you, Lisa.
Yeah.
Andy, are you also as much of an optimist as Lisa?
Yeah, I am an optimist.
Excellent.
I do believe when groups come together, and this seems to be an issue that a lot of people come together and agree on, although none of us are raising our hand to say we have all the answers, right? And I know that it's a challenge, but out of all the administrators, union leaders, and partners I talk to, all of us can agree that we want something healthier and something better and safer. And so this seems to be a place where we can really converge our work and maybe take and make some headroads. And I would also say that it's no longer an isolated issue among states. Like, I can remember 5 years ago or 7 years ago when we first started talking about this, I thought, geez, Michigan's in rough shape and we got to do something. And then I realized that it wasn't just Michigan. And then I realized it wasn't just our nation. This is a crisis that's on the top of the list for everyone I talk to around the whole globe. And so I believe it's an issue that's not going to go away. And I believe that a lot of us are going to come together and make great headroads on this. So that's where I'll stop.
Thank you both. And thanks for all of those really insightful answers. This has been great so far. I want to turn to the audience questions, and we have a good number of them. So unfortunately, there's no way we're going to get to everything, but hopefully we'll get to many of them. And the first of those actually follows something that you mentioned a second ago, Andy, when you said it's not just a problem in the United States. And that is that often in corrections reform, we look to other countries, often Scandinavian countries and Germany, to think about ways that we can change prisons in the United States to make them more effective. And so I'm wondering if we have things we can learn about staff wellness from those countries or others that maybe have healthier correctional staff, and what sorts of things we can take from those contexts and learn from. And so I'll just toss it out to either of you that might have a view on that, or both.
Yeah, unless you want to take it, Lisa, I'll jump in. So as I mentioned at the end of the month, we're having a elevation of your profession conference in Colorado Springs, where we're bringing in professionals from other countries to explore what they're doing, New Zealand and Australia, because they have made some really good inroads. And I do know that I've talked to other countries on many panels that are really struggling. So we're trying to compare best practices. I think we really do need to keep those lines of communications open. And Norway's another one that we're working with on this as well, because I don't think anybody does have the answer yet. I do believe there's a lot of good work we can learn from each other.
Yeah, absolutely. There are so many great international examples. And when I look at one of the comments here that's coming from a different country, and knowing how to respond to situations that occur, I think that's a big piece of missing information. And that is, how do we respond? How are we prepared? And we need to look at different levels of prevention. So one, primary prevention is trying to make sure it doesn't happen in the first place if we can. And then how do we set ourselves up to have really good responses and treatment? So for instance, if someone were running and tripped and fell and broke their leg, we know exactly what we would do to set that leg, get them first aid, get them to the hospital. If someone sees an extremely, or has a violent traumatic experience, what do? We don't have a leg to set. We don't have paramedics, and we don't have a place to go with it. We don't see it. So we really need to have very specific ways to look at levels of prevention and how to address these challenges. And yes, looking across the board, nationally, internationally is absolutely one way to go about that.
Great, thank you. And so with Lisa, I think this next question is probably a good choice for you, but Andy, please feel free to weigh in as well. I think that a lot of what we talked about is not unique to correctional officers, but also can be issues with police officers as well. And so I'm wondering how you might assess the literature on police officer wellness, if that's literature with which you're familiar, and whether we can borrow lessons from that research, or if you think that research sort of stands on its own and is not immediately applicable to what we're doing in prisons and jails.
Mm-hmm. Yeah, that's a great question. So typically there's more research that's been done among police officers. What we did with our critical incident study is we borrowed an existing critical incident measure so that we just have a starting point. And then we knew that we would need to adjust it from there. So we can borrow and shape and reshape. And what I've learned, though, from jail officers in particular, is that they were asked and tasked to go to training with the local sheriff's departments, because that was the only thing available for these really small rural towns. And what they said was, this stuff is not designed for us. We get nothing out of this. We are not out and about in patrol cars. We are in these facilities doing these tasks, and it's very different. So we have to be choosy in what we borrow and what we reshape, and where we need to start from scratch and really retool.
Great. So speaking of training, we have a comment/question that a lot of COs find training to be fairly repetitive and sometimes insufficient and not very well thought out. And I think many of us would find that to be the case with training that we do in the course of our day, particularly required training. And so is there, or could there be a national curriculum for well-being and officer training? Could there be best practices? Is there a place where we're seeing ideas for curricula around wellness coming together? Or is that something that we need to work toward? Maybe Andy first, and then Lisa, if you have anything to add.
I know a lot of work is being done by Desert Waters Research, and Katerina Spinaris. They have a great curriculum that a lot of states are adopting and turning to. And I know they're not the only ones out there, but I do think there should be some collectiveness when it comes to a curriculum that all departments can use to help build a program. This is the one thing I would keep in mind, is that there is uniqueness between departments, and each state is a little bit different, and each state may have a little bit different situation going on. And let's not forget about the jails and other places like that that are just a little unique in some ways. I just think it's really important. And I think that when it comes to, whether you work in a female prison or a male prison, I think there's just different nuances that we should keep in mind when it comes to some of the training and curriculum.
Yeah, and I think there's certain concepts that can be brought out across the board, and that's what we're trying to do with the NIC training. And we do have a webinar that's posted online that has some of these suggestions, but that participatory process, listening, learning, hearing the voices of workers, and then tailoring it. So like just having a process for tailoring the training that you're going to put out there and kind of pilot testing it and making sure that it fits. And then, building out those programs, like Andy was saying, I've worked with jails who they don't have gang activity. They don't have particular problems that you might see in other jails, or some jails may have a huge challenge with substance misuse, and those are the people that they're seeing coming in. So we need to tailor it based on what's going on currently, and also just focused on the needs of that program. And then also, like some of the jails, they might be with a sheriff's department, and some people can cross over to being in the car, on the street, doing policing, or in the jail setting. So again, tailoring is really important. And then the mission of that facility, that prison facility, if we're working towards reentry, how are officers trained? How do they know motivational interviewing skills? Are we a trauma-informed facility? Are we using ways to reduce indirect traumas and sharing too much information or asking too many questions, whatever it may be? So yes, I think that there's ways to offer key processes for developing training, and then take that and tailor it to what you need is really important.
Thank you.
David, I would also add just one thing to this, and that is, I think that there could be a process in which we in the United States really start to adopt when we talk about stakeholders, we should really connect with all of those trainers that are out there right now and what their viewpoints are when it comes to 21st century real training that we should be elevating in a lot of different ways, the dynamic security and other things that the Nordic model, for instance, demonstrates. But a lot of the stress that we've found through surveys we've done around the United States really doesn't come from the population. The stress comes from feeling like you're not appreciated, coming from, changes that are happening too rapidly, and you're so understaffed and you can't manage those changes properly. And so there's a lot of those kinds of things that come out of those surveys that we should take a look at when we're talking about a curriculum as well.
Thank you. Yeah. And Andy, I want to follow up with you specifically on something you just mentioned. It reflects a question that we have in the chat, which is that correctional officers are often pretty stigmatized in media portrayals. And I think that leads to they're generally feeling pretty unappreciated and often vilified for what they're doing in the course of their duty. Is there a way for us to address that would assist with wellness? Is there something that can be done on the stigmatization? Are there programs, anything that we can concretely do that might alleviate that part of the issue?
I think this is a little bit of we call it the Shawshank Redemption narrative, right? So America is fascinated with law enforcement and corrections for the wrong reasons. You turn on TV, you go to different channels, you're going to see something that's typically violent, and typically it's not. And that's a narrative change that we need in order for that to be understood by all America about what it is to be a good corrections officer, a good police officer, good anything. I think that narrative has to be changed, and I think it has to start day one in the academy. We all come in with a preconceived notion that is in our head about what that is as a good corrections officer, but there has to be a different dynamic trained. And it has to be a dynamic that says, like, this is what you're doing and it's useful and you're useful and we appreciate your work. And you're going to get a level of success along with everyone else when somebody goes home the right way. Right now, there isn't many staff who feel like they're a part of the success, right? Because of just the way the system is designed. So yeah, I hope that answers a little bit of the question, but I'm willing to go further if you need me to.
I think that's great. And it's interesting that you mentioned, and Lisa, sorry, just quickly, it's interesting you mentioned, being a part of success. And I think part of the issue is also working in organizations where what success means is difficult, right? It's not an immediate clear thing what success looks like because you don't see it on the outside until they go home. And then success is often defined as a failure to do something, which is a failure to commit another crime and go back to prison. And so it's tough, right? When the objectives are so muddied and complicated. Lisa, sorry if I cut you off there.
Oh,
please
no, that's fine. I agree with what Andy was saying, and I've seen examples from state level prison systems where they have a really strong media outreach and presence. So they are creating stories in real time when they have something to share. And then when something bad happens, they're ready to address that. So just having that process for what are we going to do when things happen, and then showcasing the good things. And then locally I'm from a small town originally, and I still get the local newspaper, and they are showcasing people who were in jail, who went through drug treatment court, who, had that series of incarceration, and then they showcase them in the local newspaper and say, great job, and that sort of thing. And so that just shows the community process, how corrections work together with the court system and so on to support people and work together. So there can be a lot of amazing stories out there, and we just have to be proactive in getting those stories shared.
Yeah, that's great. Thank you. Thank you. And we have another question that I think wants to know a little bit more about some of the specific things that would make a high quality intervention. So Andy, you mentioned the Michigan DOC, and I'm wondering if you might be able to go into a bit more detail, either about what Michigan's doing or other states are doing to promote officer wellness.
I think first and foremost, one of the successes in Michigan is where they started. Where they started was that survey, right? They really listened to what was going on with staff when they took all that data in, and then they developed a program that was separate and isolated in this way. It was a side of everything. So you were not going into a building that said Department of Corrections, blah, 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 staff wellness. This was a place where you could connect with folks offline, where you didn't feel so much like it could be scrutinized by others. It's very private. And there is some peer support involved, and they have clergy in some ways that are involved. So they have a lot of different coping mechanisms that they work with you on. I have a personal story where a very good friend of mine was stabbed several times in the neck. He wasn't going to be able to come back to work because of the stressors involved. It wasn't out of anger or anything else, but he really was traumatized. He understood that there's a chance that things happen, but how he coped with that was very difficult. And he had a lot of trying times. Had it not been for folks at the Michigan Wellness, I don't think he'd be around. And it sticks with me how effective it was that they did outreach the way they did, and they really went to him and listened to him and met him where he was at, instead of saying, you need to come back to work and you need to just get back in here and do this and toughen up. They really met him where he was at in this whole thing. and dealt with it on an individual basis. So there's a lot of things you can learn. You can go to their website, in fact, and really see a lot of the good work that's being done by Lynn Gorski and her team. So,
Thanks, Andy. Lisa, did you have any examples you'd like to share?
Sure. When I first got started in working with rural and urban jails, I went to an urban jail and suggested we wanted to do reentry services. At the same time, I also lead a whole team that does reentry services for individuals incarcerated. And I said, you know what, let's focus on the workers, because I knew that we needed a culture shift. And so we did focus groups, facility-wide. We did surveys facility-wide and really tried to understand what were their needs. And then we implemented the low-hanging fruit, things like, I can't bring my own food onto my watch because that's considered to be contraband, things like that. So having access to healthy foods, having, different supports. And then after a year and a half or so, then we started on the reentry programming. And it meant that we were going to bring women into a shared space, and a CO was going to be there to support us and help out. Then we also had a full facility-wide reentry fair where community providers for the first time ever came into the facility. And it literally took all hands on deck to make this event happen. It was a rainy day. It was like the worst situation you can imagine, but all hands on deck. People came in even on their off day because they wanted to contribute. And it was like the best day ever in this jail. They had no idea what they could do until they tried it. And they saw the potential. I mean, they had 50 community providers from housing to employment to health insurance. They had over 700 individuals held in the jail go through the reentry fair and gain information. And the COs found it meaningful. They were engaged, they were excited, and they saw the possibilities. So that's just an example of just trying something out of the box, see how it goes, and see if we can shift that culture towards this overall mission of, safety, quality, reentry, whatever it may be.
Thank you both. And we have literally dozens of questions that we did not get to, but we are almost out of time. So I'm going to stop the questions there. Thank you so much, Lisa and Andy, for joining us today. This has been really interesting for me, and I know for the audience as well. I appreciate your time and energy, both in joining us today and also working through these issues in your day-to-day work, because it's obviously a really important area. So thank you for that. Want to remind everybody that you can find a recording of the session today on the event website, along with a short event survey that we hope that you'll take. We do have another event in the series that's going to be coming up in June, where we will be talking about post-secondary education opportunities in prison. So with Pell Grants being reinstated for people who are incarcerated, it's obviously a topic on a number of our minds. We'll be joined for that session by Terrell Blunt, who's the executive director of the formerly incarcerated College Graduates Network, and Professor Aaron Castro with the University of Utah. So thank you all for joining us today. I hope you'll join us again at one of these events in the future. And thanks again to Lisa and Andy for all of your insight. Have a good afternoon.